Hello guys and girls, this is Kyle.S slash Epi, whatever you want to call me. Recently been diagnosed with Melas Syndrome, which is a part of epilepsy. Sort of a scary thing slash it is what it is, which my granddad used to say all the time. It's a non-treatable disease. They can only slow it down, such as being like having medication. I can't tell you the specifics on the medication because I can't remember exactly what the medication it is, which I'm having at the moment. I know it's sort of a lactic acidus is what it's called, and it can lead to vomiting. My experience so far from when I first came into, I think it was Durham Hospital, was basically a part where I vomited and then I passed out for maybe 2 days straight. So then obviously parents took me to hospital and everything. As far as spinal fluid to the brain, it's maybe the reason why I've got like pain in my back, mainly in my spine as well. There is like weakness in muscle, from what I'm seeing here. There's I can't even say it right, abdominal pain, fatigue as well, mainly like sort of headaches, stuff like that. And it can be from early age to early ages from age 2 till age 40, and obviously I'm 23, so I had to be in hospital, and I was 23 then. It was a bit of a, in my case, I found it a bit shitty down to what happened, when I was in the hospital on my birthday, and last year, 2022, from what I remember, I think it was 2 weeks after I came back, from southeast to northeast. It was a bit of an experience. The second seizure I remember having, like the proper second seizure, was at RVI hospital. It was kind of scary, I'll admit. I do remember it though. I do remember I think it was the nurse slash doctor. She was like right on top of me, checking if I was alright. The first seizure that I had was after a car crash, but I had to go to the hospital to check if I was alright, when I had the car crash. And I believe the car crash might have actually done something to my brain to then affect me, having these seizures, having these problems which I've been having. Like, it's sort of like a butterfly effect. I've got the letters right here as well, about like different symptoms with my diagnosis. It's it's kind of a scary thing, but at the same time, like what my granddad used to say before I went down south, and what I remember he used to say anyway, it is what it is, just take it in and go day by day, in other words. There's also the thing of like spinal fluids, not just spinal fluid, but there's also fluid from your veins to like going from your veins as well as your blood, from what I've been told. And what it says on this, like the symptoms as well as the disease overall. It's like it can go on for years and years. You can have seizures, such as like epilepsy. It is a bit of a scary thing, because you don't know when you're gonna have, like, if you have epilepsy, you don't know when you're gonna have a sort of like seizures, such as from, I've only had 2 seizures. They were from last year, but I don't know if I could have any more from that. As far as the medication wise, they have sort of helped me a bit. It is sort of a scary thing. I know the Melas Syndrome. I know it was published so far from 1993 all the way to January 10th, 2011. I know this is kind of a boring subject. I can't even say it right now. Subject, but it is down to my condition with the epilepsy. I don't really want to be in hospital, but at the same time, they're helping me out, all the doctors, me having the drugs, in other words, all the tablets, as you call them. Yeah. Right now, I'm trying to distract myself. I've been going through different books, such as from Bipolar, because I've been diagnosed from Bipolar, towards the Walking the Walls, which I did go through, and it was about epilepsy. And this one here, I'm gonna go through it. I might not do a video about it, just because it's the poetry of pharmacy. It sort of goes on about epilepsy as well, so I know with some of the conditions, like it can go from the DNA from one patient. So if I was to have children, or it comes from mothers anyway. It is a bit of a shit situation. So obviously, if I had children, it wouldn't. But if I had, a partner who had epilepsy, then it's understandable that I would pass through. As far as other sort of symptoms, you can have like strokes from. I've had it from my left hand, and it's not in a dirty situation anyway. Like a boys, doing what they're doing. Basically, it's sort of like I couldn't feel my left hand. Like couldn't move it at all. Which was kind of scary. It's the lack of skills as well. Through your brain. I suppose from my situation, I can sort of forget the words which I meant to, or what I'm trying to get out of my head anyway, or trying to speak. Has been like, what's the other symptoms? One sec. Loss of hearing, actually. That's one of the symptoms which, isn't exactly a good situation. I've had that where my right eye, this side, I couldn't hear anything for maybe a few days at least, which was scary, till the point where I had a test and they, done what they done, and I was perfectly fine after that. It might be the medication, it might be just waiting a long time, I'm not too sure. So far, there's no actual, sort of, what's the word I'm trying to get out? There's no cure for Melas as far as they've found out, which is a bit of a shit, sort of way. Sorry for my language anyway. But yeah, as far as I'm concerned, it is what it is. I'm trying to go through, what my granddad taught me, as well as how I'm trying to feel about it. I know I'm scared about it, but at the same time, it is what it is. It's something a bit scary. And as far as mental health wise, I'm going up and down. So, that is what it is as well. I'm just trying to, get my head around it. I'm trying to look through books on my condition, obviously other people's conditions, because you never know when you can have other conditions later on in the future, in other words. But yeah, apart from that, all I gotta say, it is what it is. Trying to get through it, and I'll see you guys and girls later. Peace.